Hello and welcome to the Community Partner Outreach Program training module on OHP changes during COVID-19. Today we're going to discuss some things that community partners need to know about application assistance and what that means for community partners, for applicants, and for members of OHP. We want to start by acknowledging that COVID-19 has had a major impact on all of our lives, and this has changed a lot of the different ways we do business here in Oregon. We've designed this module to provide a high-level overview for community partners of some of the most important changes that have been made to the application process and OHP benefits so that you can help people navigate OHP successfully, whether it's getting their OHP, keeping their OHP, or making sure they're able to use their benefits. First, we want to talk about COVID-19 testing and treatment. All OHP benefit levels include this coverage. This includes OHP Plus, this includes COWM Plus, and COWM. Members with COWM coverage should be able to receive COVID-19 testing both in emergency settings and also outside of emergency settings, and providers are able to bill OHP as long as they have the ability to do so for COWM or OHP Plus as it relates to COVID-19 testing and treatment. If people do not have OHP coverage, there may also be other settings where people can be helped regardless of their insurance coverage, such as county health clinics, federally qualified health centers, and other providers. We've worked hard at OHP to reduce barriers that might keep people from either maintaining or getting coverage in the first place. And some of those changes specifically made to empower community partners are accepting verbal consent via phone, remote assistance through applicant portal, and we've opened for the first time the ability to do presumptive eligibility to non-hospital community partners. Let's talk more about remote assistance. During this emergency period, we are allowing certified community partners to provide assistance via phone, Skype, or other virtual method in order to help you honor that physical distancing and keep safe while being able to assist applicants and members. If you do not have an active consent form for your organization with the client, or if you are unable to find that consent form, you can get consent to assist by phone, and we'll talk a little more about that shortly. You also will be able, in fact, as of now, you are able to complete an applicant portal application online remotely, including that signature screen, even though you're not physically in the room with the applicant. As a note, we are still requiring a physical signature on the paper 7210. So if you have to do a paper OHP application and the online portal is not an option for you, we're going to have to get a little more creative. We want to reiterate strongly that consent forms are still required. You must ensure that a consent form has been completed for your organization and that it is currently active when you're interacting with OHP applicants and members and working with the state on their behalf. If you're providing assistance remotely and can't find an active consent form, here's the process to document the remote consent. Your first step is to read the consent form in its entirety to the applicant or member and complete all sections of the form. Make sure that they understand and agree to the contents of the consent form before writing the applicant or member's name on the signature line and adding a note that specifies that the signature was obtained via phone. So it should say the applicant's name and then consent via phone or remote consent. OHP workers should, at this time, treat this document the same way they would any other consent form. So anytime you would normally send in a consent form, you can send in a consent form using this method to get remote consent, just like you would to an email inbox or along with any documents that maybe you might want to fax into the state, things like that. You should not get any pushback from OHP workers as long as that consent form is filled out completely and accurately. We also have a new tool for our toolbox, which is presumptive eligibility. So presumptive eligibility, or PE, it has historically been a hospital tool that offers temporary OHP coverage based on a short form instead of the full OHP application. This is available now for the first time to non-hospital community partners. There are a few situations where this process will be helpful and a few where it will not. For example, you can't use the presumptive eligibility process to screen for COWM or COWM Plus eligibility, and it is only applicable to one person at a time as opposed to a whole household. But that's just a teaser, because in order to use this tool, you will go through a self-serve online training that covers those 2 points and more. But we do want to make sure that you get approval from your organization and that they know you are working on providing presumptive eligibility before you get started. So make sure that your supervisor has signed off on presumptive eligibility, complete the self-serve online training, and then there's a quiz, and those are all of the pieces in order to start this process. Here's a quick preview of what that website looks like. There are 2 different paths. So anyone who is a hospital employee needs to continue using the hospital presumptive eligibility process. If you do not work at a hospital, then you can use the presumptive eligibility for community partners link. And then you will see there is a short overview, a slightly longer making determinations follow-up video, and then a post-training quiz. Once all of those pieces are done, you are able to open up the forms you can find on this same website, which is bit.ly/OHP-HPE, and you can make actual eligibility determinations and send them to the state in order to get people temporary but fairly immediate OHP coverage. So now that we've talked about some things for application assisters to keep in mind, what do members need to know? First off, we want you to know that no OHP member will lose OHP coverage during this emergency period, with 4 possible exceptions. First, if the member voluntarily requests that their benefits end, we will honor that. If the member passes away, their OHP coverage will close. If an OHP member moves permanently to another state for non-COVID-19 reasons, that is also a reason to close OHP. And that final reason is if someone becomes incarcerated. So Oregon continues to be a suspension state in this emergency period, just like it normally is. So if you see any members who are closing and these 4 reasons do not apply, then you may want to work with our processing center to make sure that everything is resolved for that client. In addition to reducing the termination of benefits, we've also taken steps to make sure that many reductions in benefits will also be stopped at this time. So anyone who would normally see a reduction in benefits will keep the higher level of benefit during this emergency period. And of course, we have exceptions. So I'm going to talk a little bit about what those are. So people who are aging out of child level coverage, so that is Cover All Kids or OHP Child, who do not have an eligible immigration status as an adult, will see their OHP plus benefits reduced to COWM level coverage. And this will happen if it is the month following someone's 19th birthday. So if I do not have an eligible immigration status and I turn 19 in March, then in April, my benefits will go from OHP Child or OHP Cover All Kids down to COWM level. One thing to specify is that this is a reduction of benefits, not a termination. So even if someone is above that 138% of the federal poverty level, I would normally close at this time. So kids are potentially eligible up to 305% of the federal poverty level, and adults are only eligible up to 138%. They will still maintain CALM level coverage, even if under normal circumstances they would be considered over income. So I want to repeat that because we're starting to get weedy. A coverall kids child who is becoming an adult, which for OHP means they have reached their 19th birthday, will see a reduction from OHP plus to CALM emergency only coverage. This is also true of an OHP child member who does not have an eligible immigration status. So as an example, if I was 18 and had a lawful permanent residency status, but only for 2 years, and then I turned 19, my lawful permanent residency status has now happened for 3 years. It's still under that 5-year bar. So as an adult, I would not qualify for full OHP until I hit that 5-year mark. And so I would still see a reduction to CALM in that scenario. And then we have a third scenario as far as who might see a reduction in their benefits at this time. And that's if I am an adult who marks myself as a lawful permanent resident on the application, for example, got approved for OHP plus, my immigration information was incomplete, and then once it's fully verified, I discovered that I have not had this status for 5 years. That's when I might see a reduction from OHP plus down to CALM level of benefits, and that's because that is the level of benefits that I was eligible for from the beginning. The additional information made it clear. So anyone who is approved for OHP plus, but once their immigration information is confirmed, is found to not have an eligible immigration status, could see a reduction to CALM level benefits. And that lawful permanent residency 5-year bar example is just one of the types of immigration status someone may have that might initially look like it is OHP plus eligible, but is actually CALM eligible. We do have one last note about reductions and how that might look, which is to talk about CALM plus pregnancy benefits. Unlike children who age out of OHP and into CALM level of benefits, at this time, all CALM plus members will keep that benefit level during the COVID emergency period, even post 60 days postpartum. So in a non-pandemic setting, once 2 full months have passed after a pregnancy has ended, that person would switch from CALM plus down to CALM level coverage. This is the one category of CALM folks who will not be reducing their level of benefits. They will stay at the CALM plus level, which includes access to the full OHP plus coverage and vision and dental care for the duration of this coverage, which will be the duration of the emergency period. A quick note that while CALM plus people will stay CALM plus even after 2 months have passed post-pregnancy, OHP plus pregnant adults will revert back to OHP adults. That is not seen as a reduction in benefits, so that will still happen. Another thing about using OHP for members is that we want to let you know, so that you can let people know, that there is new flexibility in how people are accessing their coverage, which includes telehealth. So that means that members can now stay at home and use phone, video, or other online methods to talk with providers directly, and that will be covered by OHP if it's a covered service, and that they should be able to access this at no cost to them. We are asking you to encourage OHP members to talk with their doctor or other providers about what kind of things might make sense for them when it comes to telehealth appointments. They can also speak with their CCO for more information on what that CCO is offering in the world of telehealth, and the CCO will help coordinate that care just like any other health coverage. We do want to remind you that you may have to help people with making sure they are able to get adequate interpretation when they're interacting with providers, and that continues to be something that providers must allow this, just like an in-person visit. So telehealth should also include adequate interpretation, but that might take some work ahead of time to make sure that that happens. For both you and your clients, so members, applicants, and CPs, there are some things that'll look a little different around applying and reporting changes. We are drastically reducing the pens for information, so the requirements to furnish additional documentation to prove something that was attested on the application. So we're relying a lot more heavily on self-attestation in order to reduce barriers to coverage. This means that income will be accepted as it is stated on the application and should not require additional documents or proof. So whatever is put on the application is what we will use when we are determining that eligibility. You should not get a request for income proof. You will see people still getting requests for proof of citizenship, immigration, and social security numbers if those would have required verification before. Those are called soft pens. So they are pens where coverage will start while we wait for that information to arrive. And you may see that that information also has a longer time frame in which we are accepting that proof in order to accommodate the barriers that are in play just by the fact that it is harder to get documents to the state at this time. We do want to remind you that all household changes should still be reported, even if we know that people will not close benefits, for example, if they've reported they are now over income, because we want to make sure that OHP has accurate and up-to-date information throughout and on the other side of this emergency period. So if someone has a change in income, if they have a change in the makeup of their household, a change in address, OHP still needs to know that information, even if they do not expect to have changes to their benefit levels because of that. We want to make sure we're in a good place on the other side of this emergency period as well. Here is where we get into the weeds briefly, because there is a lot that we need to know about unemployment at this time in order to make sure that people are getting accurate benefit or denial notices when they're applying and when they're reporting changes, so that we know that they're accurately getting that information into their case. So there are different types of income that people may be receiving that are specifically from this emergency period. The first one is those stimulus payments, or those one-time checks that people got and are continuing to receive. So these are the checks. I think they're often around $1,200 one time, may differ depending on the income people are getting, if they have children. Those are not counted towards OHP. They're not counted towards the marketplace. They should not be included on the application, because if they're listed as a different type of income, the system may automatically deny for over income because we're not able to verify this. We're basing this on the initial attestation. So stimulus checks, do not put them on the application. Now, we have a new unemployment compensation called the Federal Pandemic Unemployment Compensation, or FPUC. And what this looks like is it is an additional $600 on top of existing unemployment payments. It may show up on checks as $600 or $504, depending on whether people are getting taxed now or later on this. It does not count for OHP. It does count for the marketplace. So people should not list their FPUC payments on an OHP application, but if they are applying for a marketplace plan, they do need to list it there. I have been told that our systems right now are smart enough where if you count something on a marketplace application that is FPUC, we know to not send that over to OHP, and there are also some manual checks and balances being done so that workers are looking for people who might accidentally be reporting this who should not, but it will run smoothest if we do not put this on the OHP application at all. So stimulus payments and FPUC do not include on the OHP application. However, there are two types of unemployment that we do want to include on the OHP application, and that is traditional unemployment insurance, the kind that has existed pre-pandemic. That is countable and needs to be listed on the OHP application. Another type of unemployment insurance that is very similar looking to traditional unemployment insurance, but is new with the pandemic, is called Pandemic Unemployment Assistance, or PUA. And what that is an unemployment benefit that is specifically there to cover workers who do not get traditional unemployment insurance. This includes people who are self-employed, people who are part of the gig economy, so maybe they are Uber drivers, they are independent contractors, or new employees who did not have a chance to start their job and therefore they are not covered under traditional unemployment. This counts as income for OHP and must be reported, and people may get this and also that federal pandemic unemployment compensation. So this is a time where I say I said a lot. I recommend you keep this slide as a resource for yourself so that you can review it while you are walking people through their types of unemployment and what to count and what not to. We do have this information up on group site so you can access it there. This is as weedy as we get, I promise. In fact, actually, we kind of got to maximum weediness and now we're wrapping up. We want to remind you that, there is a lot happening right now and we are in this together. Things are moving fast. There is a lot that is changing. So the information we gave you here was true to the best of our knowledge on May 5th when this presentation was originally given. However, an hour, a day, a week, a month later, this information changes. And we expect it will continue to change as we continue to grow and adapt to the situation at hand. So if there is anything that you are not sure of, we want you to feel like you are connected to us. You know how to reach out to our team. You know how to find the most up-to-date OHP and COVID-19 information, which is this website listed at the bottom of this slide. There's also a lot of great COVID-19 information on the Oregon Health Authority website beyond how it applies to OHP. And as a trusted community member, your ability to help people navigate what is true and not about this pandemic is going to be very important, in addition to helping them understand and feel confident about their OHP benefits. So if you have any questions, please reach out to us. Our email, if you're not sure how to reach your regional outreach coordinator, you can always go to community.outreach@dhsoha.state.or.us, and we'll make sure to connect you to someone who can help you with whatever OHP or COVID-19 questions you may have. We also have our community partner group site, which is where we are making sure we have a COVID-19 discussion board with resources added pretty much daily. So if you have either a resource that you want to share or you have any questions that need answering, we recommend you start at group site. We have our entire community partner network and our entire community partner outreach program staff interacting with that website to make sure that we have as much as we can put up to support you all there. However, we do recognize that there's a need for resources and materials and that you might need things in another language or another format. And we ask that you please reach out to us if you need anything else as well. We want to make sure we are supporting you to the best of our abilities. Thank you so much for joining us. If you have any additional questions or concerns, please don't hesitate to reach out.